The splatter of rain in Kitgum village marks the start of yet another trying period. It is peak season for malaria infections in Uganda, with the stagnant waters too becoming a strong breeding site for mosquitoes. Malaria kills more than 100,000 people a year here, and Madi Opey Health Center mirrors the outbreak. A mother is at a loss on how to deal with her inconsolable baby who is fighting to survive a bout of malaria, while many more babies toss and turn in the hospital beds with fever. But an even more dire imminent health crisis is taking root in Uganda. Access to anti-malaria drugs is wanting, as drugs commonly known as SCTs are finding their way into a lucrative black market instead.
Districts receive drugs every month, but they are stolen.
In Kenya, climate change is raising temperatures too. Ironically, malaria-related deaths have gone down, but malaria stubbornly remains the leading cause of deaths among infants under 5 years, mostly because they have not built the same natural immunity as adults.
Malaria is more prevalent or common in the areas of Western Kenya around Lake Victoria. That means Nyanza province, Western province, and then again along the coastal strip, especially in the southern part in Kwale district.
Ideally, malaria may be developing when you start experiencing fever and flu-like illness, including chills, headache, muscle aches and fatigue. Nausea, vomiting and diarrhea may also occur. However, you will need to seek medical advice, as self-diagnosis is posing a challenge to the gains made in the fight against the disease.
People tend to equate any fever, any headache, any ill health with malaria.
Eradicating the disease that is caused by a parasite transmitted through mosquito bites has become a priority for scientists. A malaria vaccine, now in its last stage, has generated optimism that Kenya could achieve zero levels of malaria by 2015.
It is not the silver bullet we've been waiting for, but it will be an additional tool that might help in this fight against malaria.
A simple bed net can protect you from mosquitoes. The government has been able to distribute about 9 million mosquito nets to households countrywide, but it still requires 4.5 million nets to reach the universal coverage, which would mean one net for every 2 individuals. The Ministry of Public Health is carrying out tests to establish the effectiveness of making easily accessible a drug commonly used in malaria treatment known as AL in chemists. Mbilu, Sunday Live.